Welcome to the Learning Corner. Please consider subscribing to this channel for more content. Don't forget to share, comment, and like. Remember, knowledge is power meant to be shared. Hit the notification button so you do not miss out on new video uploads. Now, let's get started. Ever wondered why the simple act of peeing can sometimes cause so much discomfort? Could it be a urinary tract infection, also known as a UTI? Urinary tract infections, or UTIs, are an intriguing mystery, one that we're going to unravel today. A UTI is an infection in any part of your urinary system, which includes your kidneys, bladder, ureters, and urethra. Most commonly occur in the lower tract, the bladder and the urethra. But why should you care about UTIs? Because they're more common than you might think, and they can lead to serious if left untreated. UTIs are one of the most frequent clinical bacterial infections in women, accounting for nearly 25% of all infections. Men exempt either, although the frequency is considerably lower. This is a health issue that affects millions of people every year, and understanding it can make a world of difference. So if you've ever had that burning sensation or know someone who has, stay tuned as we dive deeper into the world of UTIs. UTIs, small name, big problem, but what exactly causes these infections? Urinary tract infections, or UTIs, are typically caused by bacteria that make their way into the urinary tract. And when we say bacteria, we're usually referring to a specific type called Escherichia coli, better known as E. coli. This bacterium is often found in the gut, where it's harmless. But when it migrates from the intestinal tract to the urinary tract, that's when the trouble begins. But how exactly does this happen? Picture this. The urinary system is a bit like a one-way street, starting at the kidneys, where urine is produced, and ending at the urethra, where urine is expelled from the body. Now, bacteria like E. coli are crafty little critters. They can travel from the rectal area up the urethra and into the bladder, where they latch on and start to multiply. If the infection isn't treated promptly, these bacteria can travel further up the urinary tract to the kidneys, causing more serious problems. It's one thing knowing about these microscopic invaders, but how do you know when they've waged a war within your urinary tract? Let's dive right into the symptoms of urinary tract infections. The signs can range from mild to severe, and it's always important to remember that everyone's body reacts differently. Firstly, a telltale sign is a burning sensation while you're doing what should be a simple everyday task, urinating. It's not normal to feel pain or discomfort during this process. If this sensation persists, it could be a red flag indicating a UTI. Now, we're all familiar with the need to answer nature's call from time to time, but with UTIs, this urge can become more frequent. You may find yourself taking multiple trips to the bathroom within a short span of time, even when there's not much to dispense. This frequent urge to urinate, especially without a significant output, is another common symptom of a UTI. Next up, let's talk about the appearance and smell of your urine. With a UTI, your urine may look cloudy or murky. It could also have a strong, unpleasant odor. These changes are due to the presence of bacteria, white blood cells, and red blood cells in your urine. Last but not least, discomfort in the lower abdomen can also be a sign of a UTI. This discomfort can feel like pressure, tenderness, or even a dull ache. It's your body's way of signaling that something's not quite right. It's important to note that while these are the most common symptoms, UTIs can also present with less common signs such as fatigue, fever, or even confusion in older adults. If you're experiencing any of these symptoms, it's always a good idea to seek medical advice. Remember, these symptoms are your body's alarm system. They're telling you that something's amiss in your urinary tract. And the sooner you heed these warnings, the sooner you can take action. Knowing these warning signs can help you catch a UTI early. But wouldn't it be better if we could prevent them altogether? Prevention, as they say, is better than cure. So how do we keep these pesky invaders at bay? To start, let's talk about hydration. Remembering to drink plenty of fluids is a key step in preventing urinary tract infections. Think of it as a flushing system. The more liquids you intake, the more you urinate, and the more likely you are to flush out bacteria before they can take root and cause an infection. Water is your best bet here, but other fluids can also do the trick. Aim for at least 8 glasses of water a day, and remember, if you're feeling thirsty, you're already dehydrated. Next up, don't hold in your urine. It might sound simple, but many of us are guilty of waiting too long to go to the bathroom, whether it's because we're too busy, don't want to use a public restroom, or simply don't feel the urge. Holding in urine can create a breeding ground for bacteria. So when you feel the need to go, don't delay. It's your body's way of telling you it's time to flush out that system. Now let's talk about hygiene. One of the most effective ways to prevent UTIs is by wiping from front to back after using the restroom. This is especially important for women as the urethra is closer to the anus, making it easier for bacteria to make the unwanted journey from one to the other. By wiping from front to back, you're helping to keep bacteria away from the urethra and reducing the risk of infection. Lastly, be mindful of the products you use. Certain feminine products can irritate the urinary tract and make it more susceptible to infection. Items like douches, powders, and certain types of birth control can all increase your risk of developing a UTI. If you're prone to infections, consider talking to your healthcare provider about alternatives that may be less irritating. Now, these are just a few preventive measures, and while they can significantly reduce your risk, they're not foolproof. If you're frequently suffering from UTIs, it's important to consult with a healthcare professional. They can help identify any underlying issues and recommend a treatment plan tailored to your needs. So, let's recap. Stay hydrated, don't hold in your urine, wipe from front to back, and avoid irritating feminine products. These simple steps can go a long way in keeping your urinary tract healthy and infection-free. With these preventive measures, you're well armed to keep UTIs at bay. Remember, knowledge is your best weapon. We've journeyed through the world of UTIs, uncovering the causes, symptoms, and prevention. Now let's take a moment to recap. Urinary tract infections, or UTIs, are infections that occur when bacteria invade the urinary tract. They can be caused by a variety of factors, including poor hygiene, sexual activity, and even certain types of birth control. The symptoms can range from discomfort or pain during urination, a frequent urge to urinate, cloudy or strong-smelling urine, to even fever in more severe cases. But don't fret. With a mix of good hygiene practices, staying well hydrated and urinating regularly, you can help stave off these infections. And remember, if you suspect you have a UTI, it's crucial to seek medical advice promptly. With the right knowledge and preventive measures, UTIs can be effectively managed. Remember, when it comes to UTIs, understanding is the first step to conquering. Stay informed, stay healthy,